my name is Dr. Clarity, and today we're going to discuss the emotion of fear and its connection to adrenaline and the fight or flight response. What happens is when you have these negative thoughts, which we call ANTS, A-N-T-S, automatic negative thoughts. And, if you have social anxiety disorder, as soon as you hear the word party, as soon as you hear you're invited, the ants start marching along by the hundreds. Oh, I don't know what to say. I don't know what to do. And immediately, in a nanosecond, the adrenaline squirts. The adrenal glands are shaped like little teeny almonds. They're about the size of almonds, and they sit right on top of your kidneys, which is in the back of your body, right over your belt. And just a little teeny weeny drop of it, like 1/90,000th of a drop, is pretty much all the body wants in a year, because it's kind of toxic and it takes the body a lot to clean it out of the bloodstream. In a stressful urban area, the average person might have 11 times they release adrenaline in a day. And if you have social anxiety disorder or nervousness in social situations, you might be releasing and releasing and releasing adrenaline every time you start to even think about a social thing coming up. Let's say there's a Christmas party at work, and for 2 months you just keep thinking about it, and immediately you go into adrenaline. And of course, that's responsible for the fight or flight response. And that's the famous thing about a grandmother who sees her grandson trapped under a vehicle, and she, even though she's frail and 80 years old, she runs out in the street and picks up the car and rescues him. And the next day she finds out it would take 700 pounds of lifting, like lifting a 700-pound barbell in a gym, and she can't repeat that because she doesn't have that adrenaline released into her bloodstream. So that's how the fight or flight response works. And with social anxiety disorder, you can bet that you're constantly releasing it. And the symptoms of adrenaline, when they're released in the body, are all those symptoms that you're used to having, which is, blurry vision. Maybe you can just have a few of these, or an inability to swallow, or chest pain, or a feeling of choking, clenching your teeth, cold hands and feet, a feeling of like being in a dreamlike state, sometimes diarrhea, dizziness, dry mouth, startle response, feeling faint, fatigue, fear of doing something out of control. There's so many symptoms. Symptoms like, oh, I think I'm going to die, or I'm going to go crazy. That's what adrenaline causes in people. A fear of vomiting, a feeling of impending doom. That's huge. Most people with fears like social anxiety always have this feeling of impending doom. A feeling like things are unreal, fidgetiness, flushing. You can get a chest flush or a cheek flush. Headaches, holding your breath is a huge one. I think some people have been sort of holding their breath for years who have social anxiety disorder. Hot flashes, cold flashes, hyperventilating is a really normal response of adrenaline. That's just what adrenaline was designed to do, is change the breathing pattern for, tackling difficult situations. Irritable bowel syndrome, jumpiness, lightheadedness, loss of appetite, loss of balance, a feeling of a lump in the throat, muscle aches, muscle tension, muscle weakness, nausea, numbness, being pale, heart palpitations is really normal, a rapid heart rate, a feeling of restlessness, inability to perform sexually, feeling shaky, shallow breathing, skin problems like itching or burning, a feeling of being smothered, stomach pains, sweating, a tight feeling in the chest, a tingling in your arms, face, or lips or legs, trembling, tunnel vision's a common one, an unsteady feeling of your knees shaking, having to urinate frequently, an urgency to urinate or do a bowel movement, vomiting, and weakness. And that's just some of the symptoms of anxiety. You notice they're all physical symptoms. So these unconscious thoughts It's like a neural network in your brain, a huge neural network from the past gets triggered, and it automatically makes the adrenaline release out of your adrenal glands, and then you get some of these symptoms. And you may just experience a couple of those every time, like dizziness or lightheadedness, or another person may just get stomach aches or diarrhea. So don't feel like you have to have all of them, but it's just adrenaline. And the more you learn this self-talk when this happens, oh, it's just adrenaline, the more you're going to have those small victories of learning how to live a way better life with your social anxiety becoming a thing of your past. This is Dr. Clarity, and thank you.